Welcome to Meet the Dean with our Dean of Samoa, American Samoa, Aotearoa, New Zealand, and the Asia Pacific, Dr. George Tuitama. Welcome, Dean George.
Talofa Nicolette, and hello to everyone else that's here today. Um, Very lovely seeing you guys, and yeah, great to be here.
Great to have you. So talofa to Aparna and Chipo and Diana and Joshua and Kiora to Judy and Carrie and Christian. Hi to Latanya and Mattia, Mesh and Nana, Scott, Kaya to Shahid, and hi to Shanda as well. And hello to any of you joining us via recording. I'm Dr. Nicolette McGuire. I'm OUM's Associate Dean for Student Engagement, and welcome everyone to the OUM community. Dean George and I want to send a special congratulations to OUM new students of the January 2025 cohort who are here today. We look forward to seeing you again next at our meet and greet, which will be Monday for those of you who are in North America and Tuesday for those of you in Samoa, American Samoa, Aotearoa, New Zealand, Asia Pacific, and Australia. Also, welcome to everyone that's joining us via recording. Today, I'll be asking Dean George a series of questions. Some of them will have been submitted by prospective students like yourselves. And for our live attendees, if you would like to ask anything of Dean George, please use the Q&A box and we'll try to answer as many as possible. If we don't get to your question today, I encourage you to reach out to your admissions counselor, or you can connect again with us on social media. And for our attendees via recording, I encourage you to pose your questions on OUM's Facebook, Instagram, or the YouTube channel where this video will be posted. So Dr. George, so glad to have you here today. Let's let everyone get to know you a little bit better. So would you tell us a bit about yourself and where you grew up?
Thank you, Nicolette. Well, as you know, that Samoa is a very small country in the Pacific. Um, if you look at Samoa on a map, you could hardly see it. Even the smallest, even the biggest globe, Samoa is still a small dot compared to most of the countries. So of course, I was born and raised here in Samoa, so from a very small village. And again, the villages in Samoa are still very small compared to the villages and areas in US and also in other countries. So in other words, I am from a very small village. It's a very cultural and traditional setting with very little Western influence. So in other words, it was a very rough neighborhood, although no guns and serious weapons of mass destruction. There was still a lot of sticks and rocks and mostly physical. So yeah, the setting was quite rough back in the village in those days. So I'm from family of nine. I've got two older brothers and six sisters. So I am the sixth from the sixth in line.
Mhm.
Yeah.
So you have book smarts and street smarts, you mean?
More like street survival.
And I'm
Yeah.
sure your six sisters didn't let you get away with too much in the family either.
Yeah, they are a handful, but yeah. Mm.
So tell us, when did you know that you wanted to become a doctor?
To be honest, it was as long as I could remember. My father was a doctor. I think he graduated in 1968. So when I was born, obviously, and he was already a doctor. And he was one of the first in his village and the first in his district to actually be a doctor. So, and in a doctor at that time, not many people had access to the hospital. So if your village and your surrounding families and neighbors know that there's a doctor in the area, they will just rock up to your place whether you like it or not. So our house at that time was like a 24-hour clinic. So it was like a normal sight for us. It was And even when we did a setting in our house, there was always two or three chairs way close to the front door, and it was always there for any expected, for any unexpected guests and unexpected patients. So it was a normal life for me and a normal site, just to see how the life was as a doctor in the village, and also the experience of just being able to help people and opportunity to help people in those times. So yeah, ever since then, I've always enjoyed, and I've always been wanted to take up and follow my father's footsteps in that way. So I'm very glad and happy that I'm here now.
And
Mm.
did you have a career before pursuing medicine?
I wouldn't say career, but I did have a big life before medicine. And this was mainly farming. And farming was, traditional and non-commercial. And most of the farming that we did at that time was mainly to self-maintain. Again, it was a guidance and following the footsteps of my father. So if we had extra, then we would of course sell it in a market, and the market is both in the districts and here in the big city or the town area. So yeah, that was to us. We don't really call it a career; we just call it a normal life. But if it was money making and a good source of income, yes, I guess you could describe it as a career before medicine. So yeah, that was what I did before I did medicine.
A lot of hard work anyway.
Yeah, it was fun though. It's always nice to get your hands dirty. Believe it or not, it's actually very therapeutic to be farming. Growing plants and growing trees can sometimes be a little bit easier to deal with than people most of the time. And every time I get stressed from work, I always like and enjoy going back to farming and mainly gardening. But it's nice to watch a plant grow. They don't talk back. They don't argue. They don't they don't make uh, yeah, they don't make a fuss with so many things. But you enjoy their fruits in a few weeks or a few months. Yeah.
What's your favorite thing to grow?
And here in the Pacific, we grow food that maybe one plant can feed maybe 15 or 20 people in a family. So, of course, a bunch of taros is good. It's very starchy. I'm not sure if people are familiar with taro. Bananas is also very common here. So, taro, bananas, and pretty much the vegetables, just a lot of veggies. Yeah, so right now we're just starting an orchid, which is yeah, also good, but yeah, I still prefer the old traditional way of farming, which is taros and bananas.
My daughter was crying today because we didn't have any bananas to offer her after dinner. She really wanted a banana, so I'm going to send her to your house next time.
It's one of the crops that actually it's not seasonal. It just depends on when you grow it and how you grow it. But it's all year round. So
Mm.
again, that's why people enjoy it. That's why I enjoy it as well, is that I don't wait for a certain time of year. And that's what happens to some of the vegetables. I mean, some of the fruit trees that we have, is
Mhm.
that only a certain time of the year that they bloom and fruit. So if we were to pick a certain plant, it would be any plant that can provide for us, or any plant that can help feed us or help us survive during the day. Yeah.
So, Dean George, you not only have the title of being an administrator and dean of OUM, you're also an OUM graduate. So, can you tell us a little bit about your medical student journey at OUM?
I did a course before OUM and it was nothing like OUM.
Oh, really?
It's a very gruesome 4.5 years. So especially when we were sort of like the trial lot at that time, in 2002 to 2006. So the online learning sort of thing was still new in the sort of academic process, not just worldwide, but especially here in the Pacific Islands. We were so used to going to classrooms and having the lecturer or the tutor in person. This time we had PCs. If you were lucky, you'd have a laptop. But trying to learn off a screen was very difficult, coming straight from learning the traditional and the old sort of context and the old way. So it wasn't easy. The learning wasn't easy, but it was still a struggle. Actually, thinking about it now, the learning in OUM is still not easy at the moment. The material is getting harder and harder.
I don't
But
think anyone
it,
would describe it like that, but
but,
maybe the
but it will.
technology is a bit better, but the
Yeah,
learning is
the technology is better. Yeah, there's some like now you've got the access to, these smartphones, and before we didn't really have those. Especially during that time, we mainly relied, and not just that, but the internet speed. So it was really rough, and most of the time we didn't have internet at home, so we always had to come into school to use the internet. And internet in school at that time there was no Wi-Fi. It was a LAN internet. So that was the life that was like here in in OUM. It wasn't easy, but I still believe that it's still not easy. However, we had a very close cohort at the time, in which all the ITM students, which is the general principal now. So if you were to do your ITM and general principal back then, everyone had to do it here in Samoa. So it was really good that we had a big campus at that time. There was a dormitory, and most of the students were mainly Australians and US students. So we had like a big sort of small community there. So university life was really good on the weekends with all the very matured and experienced people coming from the States and America. So yes, there was a lot of fun, and it was, of course, safe fun. No more uni life.
right. Officially,
Yeah.
officially safe. I didn't know that actually that the US and Australian students were coming in there on campus at that time. Um,
Yeah. So
and
it was really good, and most of those students were actually nursing students, and emergency workers. So they all had a big life before they came here. I think the average age that we had at that time was about 40.
mm,
40 plus. So there was a lot of students that came in were very matured and very experienced in their fields, and they were working, and they took 4 weeks off to come and did the introduction to medicine. So yeah, it was fun.
what made you decide to choose OUM?
What made me? I wanted to be, because I was living in Australia at that time, and my parents needed help, and I was the youngest son. So I had to come back and help out with my parents. I originally applied for medicine, but at that time there was a coup in Fiji, and they when they gave scholarships out, they said you can study anything, but you can't study medicine. You have to wait 1 year until the coup in Fiji settled down. At that time, if you wanted to study medicine, the only pathway to study medicine was going to Fiji, unless of course you were a New Zealand or Australian citizen. Then you can go on your own student loan and pay for your education there. But to Fiji was the government funded ones, and at that time we can't afford university fees and tuition, so we mainly relied on a scholarship. So we had to wait another year, or we were also asked to take our second choice. So when the opportunity came when I was here in Samoa that there was a medical school that was looking for Samoan students, I immediately jumped in and I said, look, although I don't come from a medical, prerequisite, I did something else, but I'm still interested in medicine. So luckily, I got through the interview process, and now I'm here, more than 20 years later, and I'm here now. So it was really fun. Yeah.
It's interesting that the technology has like changed a lot, but our student body still has pretty similar characteristics in terms of like having students that have healthcare backgrounds, so different types of nursing and paramedics, but lots of students who don't come from healthcare backgrounds
Mm.
as well. And that having that introduction to medicine course as it was at that time, but now having general principles, which is the first unit in our medical sciences preclinical curriculum, for those of you who may not be familiar with the general principles, really puts everyone like on an even footing and ensures people have the kind of basis that they need to go into the organ systems classes. Again, it's not easy, it doesn't make it any easier,
Mm.
but provides a way for everybody to kind of get on the same page as they're starting medical school. So, Dean George, I believe that you may be the only psychiatrist in Samoa at this time. Is that true, or have I got my facts wrong?
Yes, actually, I was until this month.
Oh,
We now have psychiatrists from PNG. We've just had one that signed in, and now yeah, so now there's two of us, and now and I also had another a doctor coming into work as a registrar, and he's still yet to go on some training. And this was when I took up the offer at OUM. So as soon as I took up the offer at OUM, there was a benefit for the unit, and now they feel like they needed to replace me. And when they brought in this registrar, and now they're getting in another consultant psychiatrist, and I think we're getting one more. So it feels good to know that to replace you, they need three people.
yeah.
So, because I had been working in this unit for more than 10 years, and I had been the only psychiatrist um, working full time without any other medical profession to help me. It was just me and a team of nurses trying to cater for a population of more than 200,000. So it's really good now that the microscope and sort of the attention is towards us, and we hope and again this is one of the benefits of coming to OUM, I guess. So even though I'm here at OUM, they still want me to lead the mental health service. So which OUM of course has allowed me to continue looking after the service, so as mainly as a consultant and just help with the overall functioning, but at the same time do my role as a dean for the medical school. So yeah.
Well, tell us a little bit about how you decided on that medical specialty. And we'd also like to know how you managed 200,000 patients.
To be honest, I did not have any interest in psychiatry at all.
Really?
I didn't know. No, I didn't.
Tell
It's
us more. Tell us more.
yeah, it was not an area. It was not an area that was interesting at the time. It was a very dangerous area to work in at the time. And
Mm,
hence the reason why no one was able to put up their hand and sort of come and work here. The place that we had our mentally ill patients was mainly in prison. So if you wanted to work here, majority of your time you're going to be spending in prison to help those patients. But the awareness was built up, and then by 2011 or 2012, something happened, and then they did a audit of the whole service and realized the only area of the hospital with no full-time doctor was the psychiatric ward or the mental health unit. So at that time, I was interested in surgery, and I was working as an emergency registrar. So of course, if they have psychiatric emergencies, they bring them to the emergency department. So it was the closest department that dealt with acute psychotic episodes, or acute substance-induced episodes or suicide, those sort of things. So they put a notice out at whoever is interested to please come and work at the mental health unit or come and cover at the mental health unit. So it started as covering just during the day or just 2 or 3 days a week, to the point that they said, look, sorry, but you're going to have to move there now. So I was sort of pushed into psychiatry, which I was 50-50 at that time. But then as soon as I came into psychiatry, I saw the need. I saw the big opportunities to develop the system, and after going through those short trainings and um, support system from the Pacific Islands and the other countries, I started to feel comfortable. And again, you just build your courage really to sort of work in an area like this. And especially right after then, they built a new unit. So I was happy then that there was a big unit. I don't have to go to the prison anymore. I don't have to work in a small building. But now we've got a fully furnished mental health unit or mental health department. So building this physical resource has really helped my work. And yeah, ever since then, we started developing it. So now we've got 3 doctors working and about 12 nurses working to cater for that population. How did we manage to do it? Again, it's a matter of developing a system that gets everyone involved. And when I say everyone, it's not just us as the clinician, it's the even the families of the patients. So we developed a system in which it was family and patient centered, more of a hospital centered. So, and that's why most of our work we carried out in the community. We wanted to give the full responsibility to the families and made sure that they were aware of it because at that time, psychiatry and mental health was still viewed as like what you call a traditional illness or more of possessed by demons, anything to do but health. So as soon as we started building those awareness and connecting to the non-government organizations, our work was a little bit easier. The referral was easier, and yeah, we just have to yeah. Again, you don't need to work hard. You just need to work a little smart.
Do you think the attitudes in Samoa towards mental health and mental illness have changed in the time that you've been working in this field?
Oh yes. So just yesterday, I think that's just yesterday, I sent some pictures over to Carmel and Grace Bieber. And these were, they asked me to come and talk about mental health in communities. And this was a youth group. So again, they gathered a youth group from the urban area, the town area. So it was about 60 participants. But and then after that presentation, I used the last two slides just to talk about OUM. And I
Yeah.
said, do you want to be a good doctor? So it's not just to be a doctor, but a good doctor. So I'm finding that I'm doing that most of the time where I'm sort of reaching out in the community. So yeah, it's fun.
Yeah, I think these are skills not just for, students who want to be psychiatrists, but also any other specialty you want to be aware of
Mm.
mental health conditions and ensure you're caring for the whole patient and
Yeah, that's
involving the
the
family. So
That's the thing. You just need to do the baseline. And medicine is more of a baseline knowledge that you need to have. It's not the knowledge, it's a baseline knowledge. So, because when you're working in the field, you will find that there's a lot of things that happen are not covered in your training. And to be honest, psychiatry in our training when we were in OUM was very little at that time because it was only about 4 weeks. But every time I came to the attachment at the unit, there was no doctor there, there was no supervision there. So it was mainly just to talk to the nurses. And even then, we weren't really allowed to talk to the patients. So most of our learning was in the books. And then after that, and then we came and faced the real world. Um, there was psychiatric patients was not just at the ward; it was everywhere. It was everywhere in the hospital, and especially through the emergency. So you need to have that ability to learn on your own. And I think that's what OUM encourages. It gives you a curriculum in which gives you guideline, but how you do it and you need to manage your time. You don't have a lecture that's readily available at certain times. There's a fixed medium of communicating with them. So a lot of it will have to rely on your ability to learn and develop a system within yourself to keep learning more. And that's the beauty of medicine is because you don't graduate and you stop learning. You graduate and you need to keep learning every year. You have
just
to
the
learn
beginning.
something new every year. Yeah.
Yeah, we are really big on lifelong learning at our university because that's what you're getting into in
Mm.
medicine. Just being in medical school is the start of learning, and it's a lifelong pursuit. So actually, I want to know, from the dean for Samoa, American Samoa, Aotearoa, New Zealand, and the Asia Pacific, what would you say are some of the characteristics of a successful medical student?
Characteristics of a successful medical student. um, Firstly, you need to be honest.
Hmm.
Honesty is very important, and um, I think it's not just as a medical student, it's just your overall well-being and surviving in this life. But when you are committed into studying medicine, it's one of the things that need to stand out as your characteristics as a medical student. You just need to be honest. And if anything, you need to be honest with yourself and owning up and understanding and acknowledging if you ever make mistakes. Most of the time, this is one of the best times to make your mistakes is when you're a medical student, because the mistakes is not the end of the world. The mistakes is the ability for us to teach you and to help correct you. So be honest, not just with your time, with yourself, but owning up to your mistakes, especially. So if there was one characteristic, I would sum it up in honesty. Secondly, is I mentioned before, is good at managing your time. Stop procrastinating, stop screen scrolling, stop doing other things that you know are not really useful, because I know that this is also one of the, I deal with the youth and other students from other universities. And I find that most of the time they're not using their time wisely. So
Mm.
if one student said that as soon as they started managing their time, they realized that 3 to 4 good hours, good quality hours to study per day was more than enough. Whereas some student, they'll be sitting in a classroom or sitting in the library for 8 to 12 hours and end up learning something that they could easily learn in 10 to 15 minutes. So quality time management is good. Okay. First, honesty. Second, time management. Third is passion. You need to have the passion. Okay, so being a doctor is not just a job and it's not just an employment. It should be a calling. It should be something that drives you to actually help people's lives. And again, you're not dealing with sort of money here. You're not dealing with a resource or a program. You're dealing with someone's life. And a life is not just someone's heartbeat, a life is their mind and their soul. And sometimes that's a lot more important than their physical health. And that's one of the things I realized in mental health and psychiatry that, you know, um, you need to have the ability to help the person, not the illness. The illness is their presentation. But in order to help them with the illness, you need to understand and you need to help the person. So you need to have the drive to the passion to not just be a doctor, but a good doctor. Yeah.
About patient-centered care, like you were talking
Yeah.
about there.
Yes.
And all of that requires time management and patience and honesty. I like that you said being honest, um, not just about, the mistakes that you're making, but being honest with
Mm.
yourself about what you need to learn, about what your goals are, and about, your passion and your drive for doing this kind of work, because it's very difficult to get into in the first place. Um, and then when you get here, it's even more difficult.
Yeah.
And when you leave here, it's even more difficult.
Yeah.
So being honest about that, I think, is really important. So I appreciate you saying
You
that,
know, in
George.
addition to that, Nicolette, it's because, these are one of the things that I summarized that were, when I talk to students about, when I counsel some of the medical students that are coming through, this is one of those things. And then I always summarize it into this after realizing that these are almost the same things that I lacked as a medical student as well.
Mhm.
So again, I'm not talking now as saying that I'm this perfect person that was honest and was passionate and good at management. No, there were very many times I was dishonest with myself. There were many times that I lost the passion, I got distracted. There were many times I procrastinated and didn't even manage my time. So when I'm putting out these, it's not so much to have it as like this burden that you need to do this or that. No, you are gonna find yourself compromising some of these principles. But again, they are there to guide you. As soon as you fall off track, just keep reminding yourself you need to have the passion, you need to manage your time, you need to be honest. So again, I'm not asking you to be the perfect medical student. We're just asking you to have honest guidelines to help you through your medical journey.
So these
Mm.
are life experiences.
Oh, yes. Because like I said, being a doctor is not just a work and a job. It's going to be your life. And it has to be that as your life, And I don't mean to say that, as a burden or something that'll stop you from enjoying life overall. Oh, you can enjoy your life as a doctor too. And it can be very enjoyable. It's got its fruits, it's got its rewards. But again, you need to look at it as, as more of a calling, more than a responsibility. It's something that you've been appointed to do. It's a blessing that's been put upon you. And now all you have to do is to bless as many as you can. Yeah.
Dean George, do you have any particular goals for your students at OUM?
What are some of the things? Okay, so I'm just trying to I'm just trying to see what I wrote down for this question. Ah, there. The two main goals really is, of course, is to help you. You need to pass with flying colors. Don't just aim to pass. That's the first goal, is that you need to pass because, and secondly, one of my goals for you is to realize your potential and to bring out the best within you. And if I was to, again, there are many goals that are great for medical students, but these are just to simplify it. And if I was to ask for priority, these are one of those two things. First, focus and center yourself at what you need to do to pass. And when you get there, you ask yourself, what can I need to do to pass with flying colors? Or to even aim for the highest, aim for distinction. And when you get to that level, you realize that you have actually brought out a big potential within you. When I first did the medical course, I actually thought I was going to fail. I had to sit remedial for 2 or 3 exams in a row.
Mm.
And for me to actually, it took almost the first 1 year for me to actually develop a system, for me to actually learn from my mistakes. And then I started finding that the more I went and the more I acknowledged those things, was the more I realized that I was actually passing. I was like, I didn't even know I was able to pass. Even up until now, I didn't even know I was going to be able to afford a car and a house at this age. I didn't even. So again, it's bringing the potential, bringing out the best potential in you. So that's one of my goals.
I like that you shared that story because that's common among students. Like they come in and they're really excited and passionate and they're used to doing well in school, and then they start doing their studies and their exams and they're like, oh, like I'm not sure I'm going to pass
Mhm.
these exams. And sometimes students fail, but you have to be resilient and you have to keep at it. Students
Yeah.
do fail and students do pass after that.
Yes. Mhm.
And we usually have people ask, what at OUM constitutes passing. So for us, our passing grade is at a 60%, but we want to see kind of everyone going to their highest potential. So everyone has their own personal academic goals. And because we are a smaller school, like we're able to work individually with our students on their particular academic goals. So if you're someone who's aiming for distinction or even high distinction, or if you're just aiming to pass all of your classes on the first try, or you're aiming to pass your classes and come out having good level of mental health and well-being, or helping your fellow students, or still being able to get to your squash game on a Tuesday night. We're here to support those different kinds of goals for you, and we're here to help you be resilient through any setbacks that you might face, just like Dean George faced those setbacks. He knows that personally. He knows how to get through them. So we want you all to know that. So let's talk a little bit about clinical rotations in Samoa. You mentioned, having and hosting
Mhm.
students in Samoa. So tell us, are students at OUM required to go to Samoa for rotations?
Yes. So it was part of the agreement in the beginning and legislating and sort of putting a policy in place for the school that because it is registered and legislated as a Samoan medical school with branches in America and United States, I mean, and in Australia. One of those things is that we need to have this experience of working in the Pacific Islands, really. And and one of those main reasons is just to, so you can see the contrast and compare what is readily available here. So yes, you need to spend at least 4 weeks in Samoa. In saying that, sometimes the student find it as a burden in the beginning, but we do have some students who have come back. And a lot of these students that have come back is they've come back because they want to do the electives again. They want to do their research here in Samoa. And some of them have actually come back to work. And I know for a fact that when I was when we started this course, most of the Australian boys that used to be emergency work in Australia, when they came to Samoa, after they did all their rotations, they went back and did some rotations in Australia, but then they opted to come back and work here in Samoa. So it can be a blessing both ways. And some of these students have really taken back the fruits of their work and used this experience to improve their work back in Australia. So it's really a win-win situation, and I think it's a great idea to have this, to spend at least 4 weeks here in Samoa, just to open your mind up a little bit. A lot of us are very privileged in working and also getting sort of the healthcare that you're getting in your countries. And when I say your countries, I mean like the big countries of Australia and New Zealand. You get in there, you get, there's always this, I always have this picture of this nice, clean place, everybody in white coats. Everything is in order, everything is in line. You'd be surprised to know that we can still provide a really good care for patients, but not have any of those. You'd be surprised to know that we can still do our work as doctors with very limited technology, with very limited resources, but we can still practice up to the standard that we need to. And I think that this is one of the great things that OUM have opened up. I think it's I think it is one of the really good things, because I don't think any other university is doing this, where it is compulsory for students to actually go to a Pacific island to work for 4 months or do their electives or one rotation.
So Dean George, I do all of our graduate exit interviews, and so I always ask students about their Samoa rotation. And everyone always has amazingly positive things to say about the experience that they have had in Samoa, in terms of what they were able to learn and the hands-on experience they got, and also how welcoming the people of Samoa were to them when they were there for their rotations, and how, we do, our students in our other jurisdictions do the majority of their rotations in their home country. But they have this additional experience where they get to do something that's very different from perhaps how the hospitals are set up in their home country. So how do you think, how would you describe how a rotation in Samoa might be different from a rotation that a student might take in Australia or New Zealand, for example?
Yeah. So I think I mentioned a little bit of this again, the context and the culture. Again, well, one of the things that might be really different is obviously the technology. We don't have too many high-tech stuff. Then you find the high-tech stuff in our high-tech wards only, but it's not readily available for most of the patients. Like, there's only a few people that are able to do echoes here. And I think there's only 2 echo machines in the whole of the hospital. So we don't have so the resources and technologies, of course, and especially the specialties as well. It is said that the last study said that for any population, you need 1 to 10,000 people as one psychiatrist to 10,000 people. So in other words, there needs to be 20 psychiatrists here in Samoa. But I can tell you, our psychiatric service is one of the best psychiatric service, not just in Samoa, but in the Pacific. I'm not being biased, but there have been many comparison of the practices that we do, some of the initiatives and some of the ideas that we come up with to help our psychiatric patients. And you'll be surprised how a lot of this context how a lot of the unique cultural skills that we use are all in line with the medicine that we practice today. So it's, yeah. Mm.
Students like they always report that like their clinical skills really improve in the 4 weeks that they're there, because the technology is different and because there's such an emphasis on that. So do students who are coming to Samoa for rotation, do they need to know the Samoan language? Do they need to know anything about the Samoan culture before they come?
You don't need to know anything with the language. You don't need to learn anything with the culture.
Mm.
You just need to be very respectful.
Mm.
I would summarize it all into that one important thing. If you are respectful, you would acknowledge the culture, you would acknowledge the language, but you don't need to know it. You don't need to understand it as well before you come here. You will understand it as soon as you see the first patient. You will get your first learning of the culture and the context when you start practicing, or when you start talking to Samoan people. If anything, even if you come and you go to the market, before you even come and work in a hospital, talking to the people as you get into the whole your accommodation, and even the people at the airport, you will find that our culture is really based around respect. And I also think that this is why we practice good quality medicine, is because we really respect our patients, and we don't just look at the illness, we respect our patients. So you don't need to learn the language and the culture before you come here. You just need to be respectful. And then as soon as you come here, everything else is very easy. Everything else will fall into place.
Is there an administrative office or any administrative staff at the TTM hospital that supports the students that are coming to Samoa for their rotation?
Yes, there is an office. Our office is in the main building, excuse me. Our office is in the main building, which is the third level of the emergency building. We have got two administrators working there during working hours. But again, we understand that some of the issues can be after hours, and the time differences as well that you have there and us. So we try and reply back accordingly as well. But we are readily available by phone. So let's say, for example, the school shuts down in December to January, certain dates, but there were some students that need to rotate around those areas too. So I'll still be working in the hospital, so I've taken upon me as well that I'll be looking after all those elective students. So again, that's how flexible we are, that we can do this within our reach. And the staff as well are also willing to, work after hours, or uh, without any compensation per se, to assist you in your matter. So it's a big family setting and context that we have here.
Thanks, George. You were mentioning a little bit about the Samoan context, and I want to ask you a couple of questions about that. And the first one is about the Commonwealth Heads of Government meeting that just happened. So Samoa was the host for the 2024 Commonwealth Heads of Government meeting, which included 4 of OUM's jurisdictions among, I think, 54 or 56 countries in the Commonwealth. Can't remember. Which were Samoa, Australia, Aotearoa, New Zealand, and Canada, where I'm from. And Dean George, you were able to be a part of those proceedings. Could you tell us a little bit about that event and your role in it?
My role in it is that I was invited by the one of the CHOCUM organizers. So again, it was along the lines of youth mental health. And also mental health was one of the main topics of the CHOCUM event. So we were there as not just the part of the facilitators and organizers, but I was asked mainly to be a presenter for the mental health session for the youth. So it was a really good opportunity to not just talk about mental health overall, but to also to experience the view and the setting from the other countries in the Commonwealth. So yeah, I was talking along the lines of because they know now that most of the youth these days, the main issues that we have is substance use. So again, it's usage of illicit substance and substance abuse. Suicide is one of them, and self-harm. And overall, it's just the mental distress in the youth today. we don't know why the younger generation are being the most stressful of all. We
Yeah.
thought that being stressful was growing up and getting married and having kids, but apparently it's found now that even before you get there, you can be super stressed. So again, this is the data, and we're just trying to identify ways in which we can address that. So I was asked to talk about the context of Samoa, what we are doing to help with those cases of youth mental health. Yeah.
Can you also tell us a little bit about Healthy Minds? So what is Healthy Minds and how does it contribute to the health and well-being of patients and families and people in Samoa?
So the Healthy Minds Initiative was an initiative that we just started as soon as I joined OUM. And this was because I had a little bit leeway and free time to develop a project in which I could utilize the medical students to actually go out in the community to practice outside of the hospital setting. And we used to do these projects when I was a medical student as well, in which we were, so it's like an emergency team that they sent out to an isolated community. At that time, every health worker that was working in Samoa was an emergency health worker. So a project was done at that time to make sure that the health was provided not just for the people who were able to come to the hospitals, but mainly for everyone in the country. So the Healthy Minds Initiative is mainly to screen people with mental distress or at risk of developing mental disorders. And I thought that this was a great opportunity to pull in the medical students to use this as to practice outside of the hospital. So ever since we've got set this up, all the elective students participated, all the local students participated, both preclinical and clinical. And funny enough, other universities have also opted to join. Other medical universities have also opted to join under the OUM flag. And yeah, so I just got a local company, phone company, to sort of fund it and sponsor this. So yeah.
So you're going out to different communities in Samoa and doing this screening. And do people just come when you guys arrive, or how does that work?
Yeah, we usually get a contact from the village or a
Mm.
contact from the community or a workplace. We put the notice out, look, do you want to be screened for free? And our screening is not just mental health. We can come and do your blood pressure and your vitals and your blood sugar level. We can even just come and do your weight and your height. So I mean, we can even come and provide you with whatever medical care that you need. But the main thing is to screen for mental distress and mental disorder. So it's really a win-win situation. And when you come doing this as well, you are seeing people that are not really sick, but you would be able to identify some of these illnesses. So it's really one really good way to start learning of how to talk to people and how to, you know, it's less pressure. Let's say, for example, if you were working in the outpatient or an emergency, there is that pressure that this person obviously has a problem that you need to fix.
Yeah.
But when you're going out to these community outreaches and screenings, sometimes they don't have anything, but at least you get the opportunity to ask questions, to
Mhm.
talk to them. And even, at the same time, it's just having fun and enjoying the culture.
Less pressure on the
Yes.
student and less pressure on the community member.
Yes.
Or in the community rather than being in a hospital. Yeah, that makes sense. I like that very much. We have a couple of student submitted questions. Would you like to answer some student submitted questions, Dean George?
Sure, sure.
So the first one is about balancing studies, and I know this is something that you are often talking with your students about. So the prospective student wanted to know, how do you recommend balancing our studies with personal and professional commitments during the MD program?
So again, this is very different. Everyone might have a different perspective on this. So I thought I'll share mine. And my one is mainly how did I balance my study with my personal stuff and my, professional commitments. And during that, it was mainly again time management. Um, I try to manage my time properly. And I found that if I was to study at least 2 hours a day, for general principles. Two good quality hours. Now, this is the hours away from the normal lectures that we had every day. If we were to do this, it really helped. And this is like good quality study, not just reading and flashing through your notes. Yeah. So time management is that. Again, it's the drive and passion. You need to ask within you, do you really want to be a doctor? And sometimes I'm not saying this to scare you, but you need to understand that you're going into a profession, and that will require all of you. It won't require half of your mind when you're seeing a patient. You can't see a patient half brained or half asleep, or you need to see them with your full ability. You need to be mentally and physically healthy. So you need to have that passion and drive to actually do that. And last but not the least, what really helped me to do all this was faith. I had to maintain my spiritual belief. And I thought, at my lowest time, when I was at the edge of failing courses, and at the same time, I had relationship issues, I had, ongoing financial issues. Um, I had to rely on my religious and spiritual faith. And of course, prayer really helped me. So again, one can say relaxation technique, and one can say, motivational videos might help them. But these were the things that worked for me, and I think it'll work for most if they really, yeah, look into it.
I like what you are mentioning just about being a whole person and about keeping the aspects of yourself that are important to you before you start medicine, in medicine as well. So having faith, being able to get through tougher times and relying upon that is really important, and having an overall support system that includes things that are really important to you. Mesh wants to know, how many hours do you recommend for a student to study in a day to perform extremely well in an exam?
Extremely well in an
Yeah.
exam. Um, so if you had, let's say, a 24-hour day would require you at least 6 to 9 hours sleep. So if you take that away from your 24 hours, so that leaves you with about 15 hours. So within that 15 hours, half that, and half of the time is doing anything else, and the other half should be that. So to me, it's at least 7 to 8 hours. If you really wanted to do that, if you really wanted to do well, and you're doing it as if you were doing a normal working hour, and that 8 hours, 7 to 8 hours is not 7 to 8 hours straight. You can divide it amongst your day. I found that is very difficult to do the 8 hours, but like I said, if you really did quality study, maybe at least 2 to 3 hours. But if you were struggling like me at times, I would find that I need a little bit more of that, and so double that. So in other words, anything from 3 to 8 hours is really good, depending on your own time and depending what you're doing. Again, most of you might going through more difficulties than I do. Most of you might have more struggles than I did. So it's really about a combination of factors. And it's not just the time that you need to worry about putting into the study, it's the quality of study that you're putting into that time.
I like that you mentioned that 6 to 8 hours of sleep as well. Students often forget that it's important to work in an
Oh,
adequate amount of sleep into.
oh, when we did rugby trainings at that time, we needed that sleep. And some of us, sometimes we even sleep for more than 6 to 8 hours. But in order for us to recover, we realized that, to me, that was one of the hardest trainings that I went to, was when I was playing professional rugby. It was, there was a time to eat, there was a time to sleep. If I didn't do those two things properly, I would not be able to train properly. So if every time someone starts doing unwell in training, it's mainly because either they didn't sleep well or they didn't eat well. So, mm.
Success advisors are always asking the students, did you eat today? Did you sleep today?
Oh,
Um,
really? Yeah.
we have another student submitted question, which is, Do I need to have a healthcare background to be accepted and or to be successful in the OUM MD program? And do you have any advice for those who don't come from a healthcare background?
Yeah. Um, Not really. Do you need to have a healthcare background? No, not really to be successful in the OUMD program. So, like I said, before I ideally it would make your life a little bit easier. It would make it a little bit smoother if you had that sort of health background and a science aspect. But so let's say, for example, like how I came from a computer engineering background that has nothing to do with medicine. And although I had an interest to study medicine, I didn't have the opportunity to study medicine. So I ended up spending 4 years studying computer engineering, and mainly internet technology. So it was, yeah. And then after that, I joined OUM. So, and all those science subjects that I did during high school was all forgotten. And I had to reteach myself and relearn all these things. So, look, you don't need to have it, but it would make it possible. And I think at that time as well that there were some students that didn't really come from health backgrounds, or they didn't have an undergrad at that time in health, but the school still allowed it because it was in the trial phase that we had. So after we did that, the reality is where there's a will, there's a way. Look, you need to have that. You need to understand that if you really want to become a doctor, you will find a way. You will find a way. You just need, yeah, you just need to keep pushing and be honest with yourself, I guess. Yeah.
One last student submitted question. What courses could I take before applying to the OUM program that makes me a stronger applicant and student?
Uh, yeah. So ideally anything around health and the science aspect. Um, it could make your application a little bit stronger. But not just that, it could really help with your overall life, understanding those scientific terms and medical terms was also one of my problems. So if you had that background and if you did a course on anything to do with science, anything to do with health related, it would make it a little bit stronger and a little bit easier. Mhm.
George, do you have any parting advice for our attendees today who may be thinking of applying into the next cohort, or maybe some advice for those who are joining us in the January 2025 cohort?
I realized that after answering all these questions, I realized that I'm like putting all this pressure and it feels so heavy of what you need to do to be a medical student. But the reality is, because these are the good aspects, and this should be, this is like a summary of all the things that you need to do, that you have to do. But it's not really the summary of everything that you will be doing and that you can do as well. So what I'm saying is that despite all this, the medicine is the end game. Graduating from medicine and being a doctor, that's the goal. But during this journey of 4.5 years, if that's the long-term goal, but try and break it up into small goals, small achievable goals, like after 6 months, I want to be learning this. After 1 year, be doing this and balance it out. The medical and study life is not all just about study. And I'll tell you one really good experience. When we were studying for the final exam of the introduction to medicine, which was general principles now, I was studying with my Australian boys. And yeah, when I said Australian boys, yeah, we did a lot of hangouts. When I was studying with them, we would spend hours, like we would sit in the library for maybe 4 to 5 hours straight. We would sit in the library and we end up, learning very little, and we would be stressing. And then we started saying, look, after this time, we are going to the beach for 2 hours, for 1 to 2 hours. And the beach, because the beach is very close, it's only 10 or 15 minutes drive. And we just go there, spend, at the most 2 hours, come back, shower, have a dinner, and then just went through the books again. We realized that after we did that, 1 hour of studying after a good relaxation was almost equivalent to that 4 to 5 hours that we try to force our study in the library. So find what works for you, balance out your life. Medicine life is not all about studying and sacrificing. It's also about enjoying the journey. So enjoy your journey that you have it. You just need to put certain things in place and have the discipline to follow it. So that's also one of the things that you need to have is just discipline to follow it and discipline to enjoy all of it.
I like that very much. Enjoy yourself. The
Yeah.
advice is to enjoy yourself. I know that all the attendees here today and those joining via recording as well want to extend their heartfelt thanks to Dean George for your time and honesty and attention today. We really appreciate hearing your perspective and the advice that you've given our prospective and new students today. We hope all of you will join us next month to meet our student ambassadors. And we look forward to seeing our new students at our upcoming meet and greet and orientation events. Thank you again, Dean George. We really appreciate you.
It's a pleasure, Nicolette, and it's great to have you guys as well.
Thanks.
Bye,
Bye, everyone.